Well, welcome everybody to your March 4th Department of Public Health update here with Rosemarie Amaral. I'm Andrew File from Every Neighborhood Partnership. So glad to just be able to give you kind of a snapshot. Obviously, things are changing a lot in our county, so grateful for the time, Rosemarie.
Oh, well, thank you for having us even on these off weeks. We appreciate you inviting us for this and realizing the importance of what's going on. So I'll try and give you some highlights, and then we'll be, and then I'll see everybody next week live. So that'll be good to see everybody.
Awesome.
Okay, so here's the first slide. These numbers were as of 6:10 yesterday afternoon, and the number of COVID cases has increased to 95,677, which is 936 more than last week, which actually we haven't seen that low of a number below 1,000 in a while. So that was pretty positive to see. Additionally, we processed another 16,549 tests, but unfortunately, we've had an additional 39 deaths registered to COVID. Overall, our COVID hospitalizations continue to slow and decrease, and we've had 57 less from this time last week, but they're still very busy. The next slide is usually our hospitalization data slide, but the CDPH database had been down last night due to an outage. I'm not exactly sure what happened. So they're having trouble since last night. And at this point, I don't have an updated healthcare slide for you, but just note that local hospitals are stable currently and doing well in regards to COVID. However, they're still really busy in the ICUs and are impacted, not only with COVID, but with other health related issues, from accidents, from disease, from what have you. It's a normal busy time for the hospitals right now. Okay, and let's see. So here are the numbers for the tiers, and we have some really good news. Our positivity rate continues to decrease. It's now at 6.0 from 6.6 last week. And our case rate has decreased as well to 14.0 from 16.6. We continue to head in the right direction, and we need all of your help to stay on this trend and to get ourselves into the red tier. I know that there's been some information that the governor has talked about in regards to changing the metric of the tiers from getting from purple to red, and I'm still needing to get more information about that. And as soon as I do, hopefully I'll have some updated and current information for you that's been confirmed for next week's presentation. We also have some really good news in regards to our health equity metric as well. Our health equity metric reported is continuing the same downward trend, is at 7.1 and is now in the red as well. And there's only, like a 1-point gap. So that's really fabulous. So I think if people continue to help us with the reinforcing of the messaging, the 5 W's, which is wear a mask, wash your hands, watch your distance, be wary of crowds. And when it's your turn, get vaccinated. This is still really important. As people are getting vaccinated, they may feel more comfortable and getting lax in some of these prevention methods, and so we really need to encourage and remind people that they still need to do this as we're still ramping up all of our vaccine opportunities. Next slide.
Remind me, Rosemarie, what's I think the governor was adjusting the positive rates per 100,000. What is the goal to get to the red? Was that 12 and under?
I think it's regarding the case rate, because the case rate is what's really hard for people. And if you look at all the different counties, even here within the Central Valley, our positivity rate is really good, but it's our case rate that's per 100,000 that's not really well. I think I read online it was a Fresno Bee article, and I think I heard that he may change it from a 7, which is where we're supposed to be to get into the red. Our case rate's supposed to be at a 7. I think he's going to change it to a 10.
10. Okay.
So, but I still need to confirm that, and I want to make sure I give you guys the right information. And so,
Yep.
I'm sure everybody's going to hear more about that, and I'll be sure to share the information next week.
Yep.
When I have it, when I have it confirmed, we like to make sure but I did, I read that in the Fresno Bee. Sometimes the media is great. They hear about it before we do.
Yep, totally. Yep.
So,
Okay.
but yeah, it's exciting stuff. Because we're really close to that 10, if that's the official mark. So I'm excited about that. Okay, so there's 3 new guidances to share with you all this week. The first one is really an updated one. It's the updated vaccine schedule that says of March 1st. So you can click on that link and get that for you. I have mine. It's sitting on my desk all the time. And the second bullet is a pharmacy vaccination site list. There are now several pharmacies, CVS, Rite Aid, and Walgreens, and there's even one Vons and Clovis that are now providing the vaccines to their customers in Fresno County. So I think that's wonderful news. It just creates more opportunity for people to get vaccinated, especially those that have challenges in getting to any of our larger clinic sites that we have going on right now. So I encourage everybody to go to that list and look it up and have it handy for the families that you're serving. The third bullet is the state guidance for outdoor, indoor, youth, and recreational adult sports. It's dated February 19th. However, we wanted to share this with you now because our case rate is at 14 cases per 100, schools may implement their outdoor high-risk contact sports. And the information is under the outdoor high contact sports session. So I just want to give you kind of a little tidbit. And so this is, such as football, rugby, water polo, the high risk type sports. And there's more information there. We also want to let you know the county is waiting for the state to send us their informed consent form that schools can use to have on file for the students that are playing these sports. They can keep it on their file, in their files. And also, we're waiting for an attestation form from the state that we'll be sending out to schools when we get it, so that they can complete it and send it back to us. And we're going to keep that for our own files as well. And then there will be some testing requirements for sports such as football, rugby, water polo, because it is a high contact. There'll be some testing requirements. So everybody can check that out. Next slide. Okay. I know I continue this every week, but I want to really make sure, we remember about the testing, because it's still really important. That along with vaccination efforts to continue this trend. And we want to make sure that we keep our testing rate up so that we don't get dinged by our case rates, as we were just talking about earlier. If we're not at that state median, we could get dinged a little bit, which, trying to get to that 10 could be really crucial. So if people have, they don't feel well, they think it might be allergies, cold, encourage them to get tested and then stay home. And it's usually testing results are now 24 to 48 hours. So it's real quick. So I encourage everybody to do that. And so this week I keep rotating the different sites for the Optum Serve sites. And here on this slide is Sanger West Fresno Regional Center, Coalinga Middle School, and then Coalinga in the downtown parking. I don't know exactly where that is, but I'm sure folks that serve Coalinga will know where this is at. And then don't forget, we also have Optum Serve sites in Selma, Reedley, at the Reedley College, Mosqueda Center, and the Fresno City College. So please help us to remind folks in the communities you're serving. And, as a reminder to the Reedley site, I think right now that's one of them. That particular one is a dual site. And I encourage everybody that's looking to get vaccinated, go to our website, because we have the right link to the Optum vaccine site. Remember, it's different from the testing.
Yeah.
So I encourage folks to go to our vaccine page and check out those different registration links. Next slide. Here are some flyers for testing events to highlight for you again this week. The one on the left is happening in Lanier Community Center, and it's coming up this Tuesday, March 9th from 9 a.m. to 12 p.m. The middle flyer is for a testing event in Selma at the Ringo Park, coming up on the 9th as well, and also on the 11th from 3 to 6. I do have a new testing event to share. It's being held at the in Fresno at the Nanakazar Gurdwara. I hope I didn't butcher that too bad. On March 6th from 9 a.m. to 1 p.m. So please, continue to share these flyers, the link, go to the link and download any flyers that you need. Also, another little tidbit that I just heard at the end of the day yesterday was that the UHC Fairgrounds testing site has now closed. That was between the city of Fresno and UHC. So, as a result, there's only going to be COVID vaccines at the fairgrounds. So if you can help us with that messaging as well, we'd really appreciate it. There's lots of places for them to go for testing. But I know folks are probably used to going to the fairgrounds too. So we'll need some help with that. Next slide. Okay. So Anna and I met with Joe this week and tried to get some key information for you guys to share. So that's what we'll do here for you. I know, I'm not as good as Joe, but hopefully.
You're all we ever want. You're all we ever want, Rosemarie.
Oh, yeah. Okay, so as everybody knows, food and agriculture, education, and childcare are now eligible and to receive their vaccine. And I know there's lots of questions around proof. So and especially in regards to the food and ag sector, if they can bring a pay stub, a letter from their employer, anything like that, that'll get them, proof. That'll be proof that they're within the food and ag sector. We're also going to the different ag companies, within the rural areas too, so they may be able to directly get it from at their job, at their site. So they might want to connect with their employer as well to find out what their plans are. I also wanted to, even though that we've now opened for the food and agriculture and education and childcare, our seniors 65 plus are still a big priority for us as well. And, I kind of wanted to, ask everybody that's listening to this recording to please maybe, adopt at least one senior and help them sign up, register for their vaccine online if needed. It may be even a phone call, or help them with transportation to and from the vaccine appointment. I think if we all can do that, we would connect so many seniors with getting vaccine and the help that they need. I know I did that for my mom, and she lives in San Luis Obispo, but I Googled it online and found a place for her in San Luis to get it. So she's now had her 2 shots. So I'm excited about that.
Yeah, I actually just got my shot this morning, and I was surprised to see how many folks. Oh, my son's joining. How many folks? How many seniors were still there, and still getting 70. Even South Summit were definitely 70 and over. Right. So I think that supporting folks and making sure everybody gets it, I think it's really important.
Yeah, I think it's it's really key because we can help protect them from severe disease and hospitalization and help to keep our seniors healthy. So I'm asking, so I'd ask everybody to try and, identify a senior, whether it's family, friends, or maybe somebody in your community that you serve, and help them to get registered to get a vaccine if they'd like to get it. So, and then, Fresno State and St. Agnes are still working hard and conducting mobile clinic sites in our rural unincorporated areas. And the health department is also conducting mobile clinics as well. And we've been trying to really focus in on the skilled nursing facilities, assisted living, and other congregate senior living locations, especially because, the pharmacy program, was not able to reach everybody. So we're just trying to reach help with that gap. And but we're also working with food and ag employers as well, especially those ones that had outbreaks before. We do have some new information in regards to vaccination clinic location. The Gaston the Gaston Middle School that is now open to the public. You know, if you remember, the African American Coalition was really trying hard, and they were successful in getting the African American population vaccinated, you know, especially for our seniors. And so that was really good. But now they've kind of opened it up, and they'd like you to call. There's not a registration link at this time, and so the number is on the slide. And all of the rest of the information on this slide, you know, with My Turn and the other locations, the information is still the same. And really try and help us to promote the phone number for people for My Turn who want to get registered and don't really have easy access to the internet. And that number is 559-312. Oh no, excuse me, I'm reading the wrong phone number. The My Turn phone number is on the slide for you to use. So I encourage you to do that as well. Next slide. Okay. So as of Tuesday, the Fresno County has received over 208,000 doses, which includes 32,000 doses received this week, which is incredible. From where we were at a few weeks ago, only getting like 8,000. So we're
Yeah,
really
that's
excited
great.
about this. Yeah. And so, you know, as we talked about, the food and ag and childcare, they're able to get the vaccine now. And we'd really like to encourage the education sector. So that's teachers and school staff, to reach out to their principal and superintendent to find out when their school clinic is taking place, because the health department is working and reaching out to all the different school districts and schools, even the really small charters and you know, home schools, everything, to see if they would like to, you know, how we can help them, you know, either set up a vaccine clinic, get them connected with a provider to do it for them, or maybe even, you know, FCSS might be doing their clinic for them. So we encourage you to reach out to your principal and superintendent. If you are able to get the vaccine before your school is providing a clinic for you, I also encourage you to please let them know, because when we're connecting with the school or a school district to do a clinic, we're always asking them how many doses they need. And so that really helps us with their planning, and we don't give them too many doses. So and that's really important because we don't want to waste anything. So so please reach out, communicate with your principal and superintendent. And then another, you know, don't forget about the IHSS email, that link, registration link that's been going around. It's still, people are utilizing it. And unfortunately, if you're not within an approved tier right now, or what are they called now? Yeah, they're called tiers. If they're not an approved
Yeah.
tier right now, you're going to get turned away. So, and that's can be frustrating for everybody. So I encourage people, you know, if you get it, just don't share it, just delete it, get rid of it, and utilize, you know, all of the other different vaccine opportunities that you have. Okay, and also for Johnson & Johnson. So Joe informed me some key highlights here about Johnson & Johnson. As you all know, they've been approved, and we're waiting to receive our first allocation, which we think is going to be on the small side, not like a 32, you know, like thousands of doses or anything. We're just not really sure yet because it's the first time we're receiving it. But what's, you know, what's unique about Johnson & Johnson is it's only one dose, as you all know, and it only needs refrigeration. And it's 85% effective against severe disease and hospitalization. So it's very safe and it's very effective. The health department plans on using the initial allocation is for our hard to reach populations, such as the homeless, disabled, incarcerated, and rural. These populations, you know, this is because these populations may be difficult to connect back with for a second dose. So we really want to be targeted in making sure we get, you know, the Johnson & Johnson out there to the most, you know, vulnerable populations that we have. And, you know, we also have new information about Pfizer storage. It's specific to their storage. Pfizer, we've been told that the Pfizer vaccine is now approved to move from ultra cold storage to a regular freezer to store for up to 2 weeks. And then plus you have the 5 days in the refrigerator. So this is really great news for our providers locally, because a lot of providers didn't have the capacity for this ultra cold storage. And so they were only getting like, you know, 100 doses from us at a time, because they had to have a plan to make sure they used it all and didn't waste anything. So now providers will be able to take more doses, and then we'll get actually more providers probably wanting to come on board and take the Pfizer. So we're excited about this new increased capacity for us here locally. And then, you know, just if the CBOs and everybody else, also all the community stakeholders that are on this call, if you can help us to educate the families you're serving, continue, please. It takes about 2 weeks after the second dose until you're fully protected. And I'm telling you, this is very important, because I have heard of people personally. I had a cousin, this happened to her. She got the first dose, and then about 2 weeks later, she got diagnosed with COVID. So you're not fully protected after that first dose. So it's really important for people to continue to follow the preventative measures of masking, distancing, washing your hands, and, you know, being wary of crowds, right? So that's really still important. And it'll be important after you get your vaccine as well. You're going to want to be careful, but it's, you know, you're not fully protected until, you know, for 2 weeks after that second dose. So if you can help us with that, very much appreciated. Next
That
slide.
happened to my mom. So
Yeah, it happened to
we
my
know that.
cousin.
Know it well. Yep.
Yeah. So, you know, I can see, because I got my vaccine this week too. And so I'm having to remember to, you know, stay cool. You still need to wear your mask and
We're not
all
out.
that good stuff. So yeah. So, okay, next slide. We also, you know, here's a reminder, and we wanted about these couple of informational flyers that you can utilize with your family, with your friends, and with people that you serve. You know, we have the What to Expect After Getting COVID-19 Vaccine flyer that was developed by our health department. And then we also have the frequently asked questions. And so that's on our vaccine page. So I encourage everybody to go there, and, you know, it's kind of really helpful. Even, you know, after I got my first vaccine, I went and looked at it, you know, that what to do after you get the vaccine, because I wanted to make sure I was remembering everything myself. So, you know, keep it handy for your, you know, family, friends, and the folks that you are serving. Next slide. Okay, so we've included just one new resource, and I put it at the top, and that's the new Fresno County Data Hub. Now I say that, but as I say that, as you know, some of the graphs that we have on our data hub are not showing. At least they weren't this morning when I looked. So just be mindful of that. We're hoping that it's fixed. It might even be fixed by now as I'm doing this recording with you all. But if you have any questions, you know, when you can, review the data hub. If you've got any questions, write those down and save them for next week, because Dr. Kokumar, our senior epidemiologist from the health department, will be providing a tour of the new data hub and answering any questions that you may have for the March 11th webinar. So that would be your homework assignment is for everybody to kind of take a look at that and see if you have any questions, and then be prepared to ask Dr. Kokumar next week. And if she can't answer them, or if we run out of time, obviously we'll follow up with you as well. And that's it.
Great. Well, and I have had, since I've been doing these, people keep emailing me their questions, or random people call me asking for advice. And I keep sending people as well to the California Blueprint website. So if you don't know your sector, and, you know, some of our tiers are in red. So people have said, we're in red now, we can open this and that. So I keep referring folks back to that website just to see your sector and where you're at. So
I think we have that link on that the tier slide. There's the link is right there. So if folks want to just control click and get there from that slide, that would that would be probably good, easy for them.
Awesome.
So okay.
Well, thanks for joining us. So our March 11th call is going to be, we're featuring obviously vaccine. DP Rosemarie will join us, DPH, Dr. K, as she mentioned, we'll talk through the data hub. And then our other kind of topic is Mayor Dyer will be joining us. And the mayor has been focused around doing some youth leadership, youth listening, and really trying to make sure the youth voice is central in his administration. So Mayor Dyer will share, as well as some folks from Youth Leadership Institute, YLI, who are doing some youth advocacy and leadership in our community. So look forward to having you join, and we'll see you then.
Sounds great. Thanks, everybody. Have a great weekend. Bye.